Welcome to this veterinary high-performance how-to guide on how to manage acute hoof and foot trauma in the horse. These veterinary high-performance how-to guides are illustrative guides designed to give information on how you might approach common clinical scenarios. My name is Patrick Pollock and I am a specialist in equine surgery. Hoof trauma comes in many forms, but the equine foot is inherently a very stable and resilient structure, and it can take a huge amount of abuse. We see a range of different traumas, from infection within the structures of the hoof itself. We see penetrating injuries, such as this one, where some sort of object has penetrated the foot, either through the sole, the wall, or above the coronary band. And we see lacerations, often when the foot becomes stuck somewhere and is pulled out at force, often because of the temperament of the horse. Occasionally we'll see loss of structures such as skin, collateral cartilage, hoof wall, and even complete loss of the hoof wall, as is the case here. The facts of acute hoof trauma are that these horses at the point of presentation are severely lame. In fact, they're usually non-weight bearing lame, 5 out of 5 or 4 out of 5 lame. Often these areas will be subject to quite a bit of hemorrhage, so there will be a lot of blood, and the supply to the foot is from the palmar or the plantar digital arteries and veins, and if they are lacerated, there'll be a significant amount of hemorrhage. Often when you're presented with such a case with an animal that's very lame and bleeding profusely, the owners and those attending the animal may think that the case is hopeless. And often these animals are subjected to euthanasia early in the course of the injury. And in fact, that's often a mistake. There are some important points to remember at the very beginning. It's often tempting to cut off bits of hoof capsule or bits of skin, but these can act as biological dressings, and they should be left in place where possible. You want to try and stop weight bearing and try and support the structures, and that can be done in a number of different ways. And this webinar is designed to give information on the emergency and acute treatment which might be appropriate for some of these cases. Stabilization is absolutely the key, so we're going to provide that stabilization through the use of casting materials, bandaging, and perhaps corrective firery through the use of a shoe. As we've already mentioned, we're not going to cut things off. We can always cut things off later on if they become devitalized, necrotic, or are lost. And bleeding from the foot can be effectively controlled with a bandage. As we've mentioned already, it may seem hopeless, but I strongly urge you to give these cases time, as the vast majority of them will do very well. All bleeding can be controlled by pressure, and a nicely padded foot bandage can be applied in the first instance, and that can be kept in place for 24 to 48 hours, which will allow that hemorrhage to stop. It's often a mistake to try and grasp the bleeding vessels with instruments, because often you end up grasping the neurological structures which are in close proximity to them. And you might think about using some sort of hemostatic agent, such as Celox, which can be used to help form a clot very quickly. Don't forget that instability is inherently incredibly painful, and these animals are extremely lame. In fact, we refer to them as being fracture lame because of the movement of the hoof wall and the skin and other structures in and around the foot and the heel bulbs. One of the most useful techniques, and really the principal subject of this short how-to guide, is how to foot cast. We're going to apply a cast in the acute phase, which will facilitate comfort and transport. And actually, in the acute phase, it can be much more effective than corrective firery. In order to undertake foot casting, you can do that with the animal standing and sedated. You'll require around 2 rolls of casting tape, and there are many different types available. Some padding for the top of the cast, some sort of felt, and the felt that can be purchased from veterinary supply companies or even from craft companies can be extremely effective for that. We don't put much in the way of dressings onto the wound. We don't want material underneath the cast being compressed and leading to the cast being loose. But we will need some sort of hard wearing cast material, and this material, with the squares on it, can be used, and then we require cold water. And that's a really important thing to remember. Casting materials are usually designed for the small numbers of rolls of cast that are put on to humans in a hospital situation, and they weren't really designed for the environments in which we're casting large animals. So having cold water rather than the lukewarm water as advised on the materials themselves tends to slow down the lamination process and allows you time to get the cast on and make sure that it all sticks to each other. Urge you not to be afraid. It's hard to cover over a hoof wound or an injury. It's hard to think that you won't have access to that for a period of time, and farriers and vets and nurses and owners find it difficult not to interfere with wounds and look at wounds. It's rarely wrong to leave the wound covered for a little bit longer, but it is hard to do the first time. Following is a series of videos designed to help you place the cast. So initially, we're going to place a dressing over the surface of the injury, as you can see here. We're also using some felt material to protect an area on the back of the heel bulb. We're going to use minimal dressing, so some sort of conforming bandage in the first instance that's going to be placed in a figure of 8 around the horse's foot. Carefully apply that, making sure that you contour it as carefully as possible to the foot itself. Our next layer is going to be an open weave bandage, and that's going to be placed after we've got adequate padding on the horse's foot. As you can see, this horse is standing quietly, and these casts are really very easy to apply in the standing horse. Open weave bandage going on now. The most common error in the placement of an open weave bandage is not placing it tightly enough. So pull that in as tightly as you possibly can. It's really almost impossible to apply that too tightly. And again, the most common reason for rubs and abrasions underneath a cast are that we've got movement of the material because the bandage or the cast is overly loose. Our next layer is a cohesive bandage, and there are a variety of different types of cohesive bandages available all over the world. And again, this can be pulled tight. It's fairly easy to break this bandage if you put too much tension on it. So it's got a kind of a crepe appearance, and the perfect level of tension is when it loses that crepe appearance and becomes smooth. And that's now being nicely placed, again in a figure of 8 pattern all around the foot. The next part of this application of a foot cast is the application of this orthopedic felt, which goes around the top of the cast. So this is the point where the cast is going to be protected, or the skin underneath is going to be protected from the foot. We're then going to apply the casting material itself. So this has been immersed in water, squeezed, emptied of the majority of the water, and we're going to start here at the level of the top of the cast. So we're going to overlap about half of the orthopedic felt, and we're going to then again apply this in a figure of 8 pattern. You can see the next roll of casting tape is already available. Remember that all of the rolls, all of the different layers of casting material need to laminate together so that we end up with one construct. And again, that's the reason for using cold water, to slow down the lamination process so that everything sticks together and we've got one unit of cast material, which will then be as strong as we need it to be. Our equine patients are heavy and they move around a lot, and an adult horse will wear through cast material really very quickly. So we want a very strong construct so that we don't end up with a hole in the bottom of the foot. And you can see here we're just rolling the cast material a little bit down from the front because we've just gone a little bit too high, and we just need to be a little bit careful here that we're leaving a sufficient area of orthopedic felt to stop us from ending up with a jagged or a sharp area at the top of the cast. And then we're going to make sure that we're nicely stuck down. A bit of water on that cast, really just to help with the lamination process. You'll hear that lamination process. We get a bit of a noise, we get some bubbling, and it's an exothermic reaction, so we will feel some heat as we apply the cast, and we know things are starting to happen. Second roll of casting tape is now being placed to make sure that we've got a really optimal level of thickness of this, and again it's being pulled as tight as it possibly can be, really to give us the optimal amount of casting material. Now, as we get towards the end of this, we're at the stage where we are ready to do the most important part of this entire casting endeavour, and that is to place the foot onto the ground. We're going to get this cast conforming most effectively to the foot if we place it on the ground as it's drying, as it's laminating. So you can see actually the surface of it has become a little bit rough. That's the bubbles that you can see, and in a second we're going to set this foot on the ground. If you're having trouble getting the horse to weight bear on that, lift the contralateral limb as you can see here. So contralateral limb is going to come up like that, and now we've got the cast nicely sitting there, and we leave it standing like that until that cast is dry. The final part of the procedure is going to be placing some sort of hard wearing material on the bottom of the cast. This is Vetlite or Hexalite. It's a hard wearing version of the casting material, and the horse won't wear through this. You require boiling water for this. It's applied once the rest of the cast is dry and laminated and hard, and you use boiling water to allow that to melt, and then it can conform quite nicely. If it goes off too quickly, pop it off, put it back in the boiling water and reapply it to the horse's foot. It's really important that that stays in place and sits very nicely on the underside of the cast. Now, if you don't apply something hard wearing to the bottom of the cast, then the horse will wear through that in a period of usually around 24 to 48 hours. There are other options, and you might consider using something like polymethyl methacrylate, PMMA, which is used more commonly in bovine practice for treatment of conditions of the cow's foot. It tends to be quite smooth and can make the bottom of the cast quite slippy, so it sometimes needs to be incorporated with this material that's being used here. Of course, we must remember that if we're applying a cast, we really must be very careful about making sure that we have the means to take the cast off. So we need an oscillating saw to remove the cast, and we can buy that in a hardware store. You don't have to buy a proprietary medical one, and they're not particularly expensive. Take great care in removing the cast from the horse's foot, because although the oscillating saw is designed not to cut soft tissues, it will absolutely cut through hoof wall, and so you must be careful when removing it. And then we're just placing some elastoplast around the top of the cast to stop bedding material from sliding down into the cast, and that elastoplast at the top of the cast should be changed fairly regularly. You will get immediate comfort from the application of a foot cast when you've got a laceration or an injury or a hoof wall avulsion, and then that will give you time to take stock and to make a plan. In cases where we've got trauma which is affecting only the hoof capsule itself, then the hoof capsule can be stabilised with casting tape alone, and you may then opt to get a farrier to in fact nail a shoe directly into that cast and into the foot. Here's a nice example of a injury. You can see a big crack affecting the coronary band and almost going all the way down to the solar surface. This area has been debrided, and you can see here that we've got we've opened it up, and there's really quite a bit of mobility here, so we need to do something to stabilize that. We're stabilizing that in this case through the use of a combination of a hinge which has been applied across this with some screws, and then there's some glue being applied to the foot surface, and over the surface of that glue we're going to apply this cast here. Now watch very carefully as this cast is applied. I'm inordinately grateful to farrier extraordinaire Mr. Jim Ferry, well known to anybody in the world of horseshoeing, a member of the International Farriery Hall of Fame, who's applying this foot cast for us. And you can see in this case the cast is being applied over the top of the glue, over the top of the bracket which has been put in place to help us really make that damage, keep these two bits of the foot operating together. Because what we want to do really is to stabilize the coronary band so that we can get new horn healing down really very nicely from that area. And so the cast is being applied, and we're going all the way around to make sure that we've got a really nicely applied foot cast, going back and forward to really give us as good and as strong a compression as we can possibly get. Once that cast has laminated, what we're going to opt to do is to remove the area over the heel bulbs. That's going to compress the foot and going to potentially make this horse painful. So you can see here we're using a rasp to remove the area of the cast over the heel bulbs themselves. So this cast is only going to be positioned over the dorsal part of the foot and also on the sole, and then we're going to be using a knife just to help us cut off the remains of the back of this here. So we're leaving the heel bulbs to move as normal, really to just increase the comfort for this animal. So you can see cutting those quite nicely, and you can see the skill involved in this. This is something that you really want to develop the skills to be able to do carefully. And then we're just going to take off that cast material. So now we've got the cast material removed from the heel bulbs, and that will allow us to allow those to expand as they normally would. The final part of this is to place a shoe. So in this case, we've got some hoof putty, some dental putty in fact that's going to give us a cushion support underneath that bar, and this is a full bar shoe which is being applied to give additional stability to this foot on top of what we've done with the cast. So really a variation on the theme when we've got trauma affecting only the hoof wall itself and not affecting the soft tissue structures of the distal limb. A couple of examples of foot casting now for more simple laceration. So a laceration here involving the heel bulbs, digital cushion. You can see this is very elastic tissue, so when the animal's not weight bearing, the laceration is closed, but when the animal puts its foot on the ground, the elastic tissue of the digital cushion expands and this will open and close. If you use conventional suture material to close this and place it in a foot bandage, it will almost certainly break down and hypergranulate. So this was placed in a foot cast. You can see the foot cast in position now, and this is the cast once it's been removed. At 14 days, you can see the wound was sutured and then casted. We've got a very nice white epithelial scar, and this is really healed beautifully. Another example involving both hoof wall, collateral cartilage, coronary band, and the skin. And this animal was initially placed into a bandage for the first 24 hours for the purpose of hemostasis. That was then replaced with a foot cast at that point, and the foot cast was replaced at 2 to 3 week intervals. Once we had healing of the defect, we placed a shoe to give further stability, and this animal really did very well. You can see in this case the coronary band appeared to have been lost, but in fact here we are now later on in the progression of this case, and in fact there was enough coronary band tissue there to allow new hoof wall to form and to grow down. So be very aware of that whenever you are dealing with these. Once you've got a large shoulder defect, such as this, you may opt to protect that using some sort of hospital shoe. This is the hospital shoe that we use, made by Jim Ferry, our farrier. Keratinization takes between 6 to 12 weeks. That's the hardening of the tissue. So nice healthy granulation tissue. Again, dry swabs against that, keeping it moist and clean, and no chemicals. So things like sugardyne, iodine and sugar, and chlorhexidine should be avoided if at all possible, because you're killing cells. And that is really how we deal with acute foot and hoof trauma. I should finish with a disclaimer for veterinary high performance. The information presented here is for illustrative purposes only and is based on our views and the opinions of anyone. It's not based on the opinions of anyone we work for or have worked for in any context. The series is not intended to provide veterinary advice, and if you are faced with an injured animal, you must seek the advice of a veterinary professional in your jurisdiction. I hope this has been useful and informative, and please don't hesitate to contact us if you'd like more information.